Hi everybody. Today we're going to be talking about female offenders and some of the special needs that might be required in treating those of the female gender. So what we do know is that between the years 1980 and 2001, the rate of female incarceration in the U.S. increased fivefold. Basically, so 5 times the number of women were incarcerated over that period. That was largely due to the war on drugs, and women who were addicted to drugs were ending up in the criminal justice system. Still today, while that increase is not as rapid as it was during that decade period, the rates of incarceration for women are still growing at higher rates than those for men. It's currently estimated that about a little over 200,000 women in the U.S. are imprisoned in jail. So that's about 1/10 of the number of males. So while there are still many fewer women than men, we still are seeing larger amounts of women involved in the criminal justice system. About 1/3 of all the women in prisons in the world are located in the U.S. So similar to our general incarceration policies, we are incarcerating females at much higher rates than countries around the world. So you can see the graph here. These were the numbers of women incarcerated per 100,000 from 1910 until 2014. And you can see in the 1980s that sharp spike. That was that fivefold increase. There was a bit of decrease around 2010, and then now we're seeing a little bit of an increase again, but those rates are still up there. And then in terms of what we're seeing with women, about 16% are incarcerated, meaning they're in jail or prison, so they are locked up. 9% are on parole, meaning they've served their time and are now under the control or care of the criminal justice system of the community. And 75% of women are on probation, which meant they were not incarcerated, but they do have sanctions in the community. Of those on parole, men and women, about 25% are female. And that kind of plays into the bottom bullet, where we see that males are still getting 63% longer sentencing for the same crime as females. So we do have a sentencing bias by gender, such that males get more severe sentences than females, and women are more likely to get parole than males. One thing that we're going to be considering in our discussion today is that the majority of females who end up in the criminal justice system are abused. 75% suffered severe domestic violence prior to their incarceration. That's either from a marital partner or somebody who they were romantically involved with. And 82% suffered severe either physical or sexual abuse as children, with about half of them, depending on whether it's the jail or prison population, reporting sexual abuse. So if we look at the demographics of females, actually there are more women, white women incarcerated in the U.S. than Black and Latina women. The issue, however, is that the rate of incarceration per population is twice as high for Black women. So if you're a Black woman, you are twice as likely to be incarcerated as a white woman, or actually more than twice as likely, 113 per 100,000 for Black women and 51 per 100,000 for white women. The only confounding factor is that because this is based on race, they often include Latinas with whites. So it's not clear exactly how much of that white sample is actually Latina. But the rate that I was able to find is that about 64 per 100,000 Latinas are incarcerated. So it's still higher than white females. The average age of those women who are incarcerated is 25 to 34, so they are on the younger side. More than half of them are unemployed at the time of arrest, and only about half of them have high school degrees. A lot of them are not even finishing their high school. So when we think about gender, going here, we look at the female imprisonment rate per 100,000. So you can see that the rate for Black women has been decreasing steadily since 2000. The rate for Latina women is kind of remained steady, up and down a little bit, but we are seeing a slight increase in incarceration rates for white women. Again, we're still trying to figure out some of what that is. A lot of it is as a result of drug involvement, as we're seeing more white women getting involved in this opioid crisis. So if we look at distribution of annual incomes for women who are incarcerated, the bar graph on the left, the yellow one, that represents women who are incarcerated. The bar graph on the right, the orange one, represents women who are not incarcerated. So you can see the biggest bars are for people who are earning less than $22,000 a year, which is below the poverty level, obviously. So not quite twice the amount, but it's getting close to that of women who are involved in the criminal justice system, who are making below the poverty level. So you can see that socioeconomic status is coming into play here. The other thing that we need to consider with women is that more than half of the women who are incarcerated are parents. About 62% of those in state prisons and 56% of those in federal prisons are parents of minor children. When we look about in terms of offenses by gender, we see differences between males and females here as well. So we're seeing the majority of women, which are the blue bars here, are getting involved with property and drug offenses, and fewer percentage-wise as compared to men are engaging in violent offenses. So that also has implications for treatment. So based on that data, and the readings that you've had this week, you can kind of conclude that women may have some different needs than men when they're incarcerated, as we see that women who are incarcerated are more likely to be victims of physical or sexual abuse. They're more likely to be responsible for minor children. They're more likely to be addicted to drugs when they're incarcerated. About 73% of women who are incarcerated have a diagnosable mental illness, depression, anxiety, schizophrenia, bipolar disorder. And as we saw, a large chunk of the women, more than half, are unemployed before incarceration, and 42% don't have a high school diploma. So as we are now seeing these rapid increases in the numbers of females in the criminal justice system, we also have not seen, though, a matched increase in the number of specialized programs for them. So we're now seeing more women involved in the criminal justice system, but we don't have the programs that they need. So when we're designing programs for females, we need to take into account their special needs. So we saw the majority of them are addicted to substances. So we need substance abuse treatment. We need healthcare services, vocational and academic education, parenting skills, as the majority of them are caring for minor children, and trying to keep them in the community as much as possible, and providing, intermediate sanctions so they're not being taken away from their children when possible, because the majority of them are not committing serious violent offenses. A lot of them are committing property and drug offenses, which probably can have sanctions in the community and don't require prison time. So it's estimated that women who are under the control of the criminal justice system are the mothers of about 1.3 million minor children. So only about a quarter of the kids, when the mother is incarcerated, go to live with their father. The rest of them either live with grandparents, a family member, or they end up in foster care. About 10% of the kids whose mothers are incarcerated end up in foster care. And so, we're thinking not only about the women, but about the children here. And if you are separated from your parents, especially as a young child, there are some long-term effects that they have studied in terms of trust and bonding. Those kids are less autonomous. They have a lesser ability to get along with other people. They have problems with their relationship to authority. About 1 in 10 will themselves get involved in the criminal justice system, which is higher than kids who don't have incarcerated mothers. And then young infants and children, young children may also experience developmental delays, because the mother is the one who generally interacts with the child the most. And if the mother's not there, they may not get that interaction during that pivotal developmental stage. Also, if we're separating mothers and children at birth, if we have a lot of women who get incarcerated while they're pregnant, the mother may not reunite with her child when she's released, because she hasn't had that bonding time. So a lot of the gender-specific programming that we see focuses on this mother-child intervention, because we say that 2/3 of women in the criminal justice system are mothers. So we have visitation programs where kids can come into the prisons. There are camp programs where it's like traditional summer camp, but it takes place in the prison and the mothers get to participate. There are nursery programs where the women can keep their children or their younger children with them after they give birth. And there are community collaborative programs and services like literacy, parent-teacher conferences, video conferencing, so mothers can still stay involved. And they actually have Girl Scouts Beyond Bars, where they have the meetings within the prison walls, and the kids come in and the mothers participate in the Girl Scout meetings. So There have been limited studies, about 22 of them to date, looking at the effectiveness of these types of programs, and a lot of them are flawed methodologically, but one recent review, and part of it was a meta-analysis, found that these types of mother-child intervention programming reduce the likelihood that the mothers will reoffend once they're released. Also reduces the likelihood that their children will be incarcerated in the future, which is a huge outcome as well. Um, it also increases the likelihood, especially for those kids who are born while the mother is incarcerated, that their mother will reunite with them, which is another big plus. And we do know that having children, coming into into the prisons doesn't have any negative effects on the children. It doesn't necessarily have positive effects other than what we just mentioned, but it doesn't have any negative effects too. So the consensus is that these are things that are probably good and that we should probably keep continuing them and studying them with more methodologically sound studies. So when we look at the effectiveness of mother-child interventions, none of the 14 states that use them assess the effectiveness of visitation or camp programs. State officials reported they consider these best practices and not necessarily programs about themselves. And in Nebraska and New York, they evaluated their nursery programs and found that overall they decreased recidivism and increased reunification for the mothers after they were released. So there are also parenting programs which teaches women how to improve their parenting skills. As many of these women have had their children, while they themselves were still children or quite young, many of them have not learned appropriate parenting skills. So it focuses a lot on education, discipline, building positive relationships, age-appropriate expectations, communication skills, and self-care techniques, so that when these women are released from prison, they'll be able to reunite with their children and work on some of those mother-child relationships. Another thing that we see among females who are incarcerated is high levels of PTSD, and that ties in directly to those abuse statistics that I showed you earlier, with about, over 70% of women reporting domestic violence and about half of the women reporting sexual abuse. So we find ranges for PTSD of incarcerated females between 25 and 65%. Females in the criminal justice system are twice as likely than men to experience PTSD. And about 90% of the women who have PTSD also have a comorbid substance abuse problem. A lot of people will self-medicate their trauma with drugs and alcohol. They kind of dull the pain. And in meta-analysis, and if you remember from our previous lectures, the meta-analysis is when they gather all the studies and look at larger samples, found that trauma work in prison actually decreases the rate of recidivism, because we're seeing, as you know, with women, a lot of the crimes are related to drugs and alcohol, and so if we decrease the trauma, then they're going to decrease the need for substance abuse, and therefore it will decrease their incarceration rates. So you've probably learned in some of your previous classes, like abnormal psychology, about the symptoms of PTSD, but just as a reminder, some of them are nightmares of this specific event. So people who have PTSD have experienced a significant trauma. This can be repeated sexual abuse, or it can be a one-time trauma like a rape. You then start avoiding people, places, and other stimuli which are associated with the trauma. So you avoid thinking about or going to places that remind you of the trauma. You can have flashbacks where you feel as if you're back in the situation. You have thoughts about the trauma when you don't want to. You have persistent anxiety. You have increased arousal and hypersensitivity. So if somebody taps you on the shoulder, you might jump. You have sleep disturbances where you have difficulty sleeping, and that's often associated with the nightmares, because when people who have PTSD fall asleep, the nightmares come back to them. You have diminished increase in participation in activities. You also see a lot of comorbid depression with PTSD, so you're seeing that withdrawal from society, feelings of detachment and isolation, and that psychic numbing. You just kind of feel dead inside. So what we have started working on for women who experience trauma, which is a lot of the women in the criminal justice system, is integrating trauma-informed care into their treatment and dealing with the trauma, and making sure that there's a safe environment, because prison is a very kind of scary and dangerous environment, so we don't want to re-traumatize people, and we are treating the trauma appropriately. For those who have extreme trauma, you can do exposure therapy, where you gradually expose individuals to the trauma they faced. That needs to be done by a trained clinician and generally is done in individual therapy. Groups on trauma-informed care can be done where people are working on kind of coping with the trauma, learning different types of coping skills, and that's usually done in conjunction with substance abuse treatment. And there's also pharmacotherapy, which people can receive medications to help them, cope, although that's only a short-range solution. And when you think about people who are also engaging in high degrees of substance abuse to cope with their trauma, pharmacotherapy might not be the ideal solution. So as much as we can incorporate psychotherapy, coping skills, and helping them deal with the trauma that they've experienced, because we know that one of the things that happens when we're traumatized is that we avoid thinking about it, which then causes us to think about it more. It's kind of like that. Don't think about the white elephant will then cause you to think about the white elephant. It just kind of pops up even when you don't want to have it. So the more that you're able to process the trauma, the more able you are to kind of deal with it. And a lot of those really like intrusive symptoms like the nightmares, flashbacks, thoughts you can't get rid of subside, which then makes it easier to cope with. So those are some of the things that we need to consider. There are lots of other things that we'll talk about as we talk about some of the other special populations and issues that also can apply to female offenders as we go through. And I look forward to hearing your discussions.